Tonight, a Target 12 investigation, we expose why local hospitals are keeping you in the dark about potentially deadly infections. We're talking about infections people get while in the hospital. Despite promises to go public with information on these killer infections, the state has failed to meet its own deadline. Target 12 investigator Jared Holbrook first exposed the dangers more than a year ago. Now he's asking why the state is falling behind.
Our investigation began a year ago. By now, there was supposed to be a plan in effect making the number of infections available to you. But that hasn't happened yet. And tonight, we have some tough questions for those in charge. Patients sometimes get infections while inside hospitals. Infections they never check in with.
It's happening, I think, more than people realize.
They're called hospital-acquired infections, or HAIs. Dr. David Gifford, the director of Rhode Island's health department, says hospitals create their own standards for keeping track of the number of infections per year. And currently, hospital administrators aren't required to share that information.
Has anyone in Rhode Island ever died from a hospital-acquired infection?
We don't know directly that information, but I am sure, as across the country, there are a number of people who develop infections in the hospital and do die from that.
The Centers for Disease Control estimates nearly 2 million people a year get HAIs, and about 99,000 of those cases end deadly. Nikki Dudley's dad, Bob from Bristol, is one of those 99,000 cases. He was in a Maryland hospital when he got a staph infection he never had when he checked in.
He was finally doing better, and then, I don't know, and then it was just like the opposite, and then he was gone, you know?
The Target 12 investigators first revealed this problem in November of 2006. Since our investigation, the state was supposed to form a committee to define and classify HAIs, then report those numbers to the health department, which would make them public. This is what the health department told us back in November of 2006.
November 07 is when we expect the subcommittee to report back on what the standards for reporting should be.
But now in 2008, more than a year later, that still hasn't happened. In fact, Dr. Gifford says their efforts to make the numbers public have been put on hold.
We've had to put that on hold given the budget issues this year.
Why is it a problem to fund a committee to sit down, come up with some standards here, and then get everyone on the same page here in Rhode Island? How does that cost a lot of money?
No, getting a committee and people together is an easy task to do. It's figuring out how you collect the information, how you develop the measures, and developing those standards. There you need to get experts, you need to get consultants in. There you need to actually go out and collect the data and see it costs money to send people out and collect the data. That's where the expenses are.
You go to the hospital to expect to get better, not to get worse. He fought really, to the very last second, and then it was just over.
Dr. Gifford says they won't even begin working on making the numbers public until August. Even then, it will take months after that. So how do you prevent an HAI? The Department of Health recommends you make sure your health care provider washes their hands, because according to studies they've done, half of all Rhode Island doctors don't. With the Mobile Newsroom, I'm Jared Holbrook, Eyewitness News.
To learn more about hospital-acquired infections and steps you can take to protect your loved ones, go to our website, WPRI.com.
New at 11.